On another quiet day in the Capitol, we're going to talk a bit about health care. With me is Senator Murphy and Senator Smith, both very powerful advocates in terms of affordable quality health care. We'll all talk for just a few minutes and then we'll throw it open to questions. The reason we brought you together here, as we speak this afternoon, two tsunamis are coming together that will have dire consequences for the future of Americans' health care. In Texas, Republicans from states across the country, with the support of the President's Justice Department, are arguing today that the pre-existing condition protections in the Affordable Care Act ought to be gutted. And the latest that's just come in from Texas is remarkable. The President's own Department of Justice admitted a little bit ago what we have been saying all along. There could be potential for chaos in the insurance markets if parts of the Affordable Care Act are tossed out. So, the American people want security in health care, and yet they have been told by the President's own Department of Justice that there is potential for chaos. Pretty hard to swallow if you're someone who has cancer, an extraordinarily powerful pre-existing condition, a person we feel deserves airtight, loophole-free protection from pre-existing condition discrimination. So that's what's going on in Texas. Here in Washington, Senate Republicans are hustling a Supreme Court nominee through the Senate that is hostile to Americans' health care rights and who would be a rubber stamp for the President's agenda, including a vote to throw out the vital health care protections families count on. Now, the court case, Texas versus the United States, is a last-ditch effort that we believe is going to create a dark cloud of uncertainty for families and is one of three principal ways Republicans are trying to turn back the clock on health care. First thing they're trying to do is push junk insurance. I was director of the senior citizens for about 7 years in Oregon before I got elected to Congress. It was common to see older people have 15 or 20 of these Medigap supplements that weren't worth the paper they were written on. And this junk insurance really is a modernized version of the worthless paper sold to older people. And you're going to see junk plans coming on the market in the coming weeks that will make clear exactly what unsuspecting Americans have coming. Second, there's a big appetite to roll back major parts of the Affordable Care Act, like the Graham-Cassidy bill. This is something we held off in the Senate Finance Committee, where I'm the ranking Democratic member. But just the other day, the Vice President confirmed that Republicans would try again if they're able to after the election. And Graham-Cassidy basically takes the guarantees that seniors would have, for example, in Minnesota and Connecticut, guarantees for nursing home coverage, because 2/3 of the nursing home bill in the country is paid for by Medicaid. It would unravel those guarantees and create a big block grant. And third, of course, is why we are here today, the attempt to rip up protections for those with pre-existing conditions. And I'm going to close with just one last point. Senate Republicans know that they're in trouble with the millions of Americans who have pre-existing conditions. The Attorney General even said that what the administration is seeking to do is sweep aside the protections for pre-existing conditions. So what you have in the Senate now is an effort to get well. And what Americans want is a health care safety net. And what Republicans are really pushing is a political safety net, something that might cushion them when Americans see they're unraveling pre-existing condition protections. There is a bill that a dozen Senate Republicans have introduced that they trumpet as their plan to make sure that people with pre-existing conditions are protected. This bill is just as deceptive as all of the other Republican attempts to turn back the clock. It is a wolf in sheep's clothing, because even if an insurance company has to sell insurance to somebody with a pre-existing condition, they can exclude benefits that treat the condition. If you were to ask for a comparison, it's like seating somebody at a restaurant, telling them that they'll pay the same price as everybody else, but then never bringing out their order. A cruel deception. So it's clear when you add up the set of challenges, and it's exemplified by what we're focused on today, pre-existing conditions. Not only would the Trump administration turn back the clock on health care, the American people, particularly working families, retired people who might not be eligible for Medicare, they're going to find themselves back in the wild west of health insurance, where insurance companies call the shots and working folks take it in the chin. Senator Murphy and Senator Smith, and then difficult questions for them and softballs for me. Senator Murphy.
Thank you very much, Senator Wyden. Thank you all for joining us here today. Listen, President Trump couldn't destroy the American healthcare system here in Congress because the people rose up in support of protections for people with pre-existing conditions. Now President Trump is trying to get his dirty work done in the court system. That's what was playing out today in that federal courtroom. Congress voted 60 different times to try to repeal the Affordable Care Act. None of those efforts passed. When Republicans got control of the House and the Senate and the White House, they still couldn't repeal the majority of the Affordable Care Act because people rose up all around this country. People who were sick or who had a loved one who were sick or who had been saved from bankruptcy because of the affordable health care that they received. And President Trump is pissed. He's mad that he couldn't unwind people's health care through the legislative process, and now he's trying to do it through the judicial process. Now, he's got a lot of friends in that effort. There are 20 attorney generals who were in court today arguing to make it unconstitutional for Congress to protect people with pre-existing conditions. The executive branch almost always weighs in defense of statutes, whether they agree with that statute politically or not. The president broke precedent, sent his lawyers to that federal courtroom to rule, to argue that protections for people with pre-existing conditions, in this case, in the Affordable Care Act, were not allowed by the Constitution. And Brett Kavanaugh is a key part of President Trump's strategy to use the court system to strike down protections for people with pre-existing conditions. President Trump believes that the power of these 20 attorney generals and the Justice Department will convince this judge to deny care to people with pre-existing conditions. That case inevitably will come before the Supreme Court. The reason why Donald Trump outsourced the choice for the vacancy on the Supreme Court to two political groups that have spent their entire time fighting the Affordable Care Act is to assure that his selection would rule to invalidate the Affordable Care Act and its most important provisions. And so you are seeing today the full scope of the Trump administration's strategy to use the court system to do what the legislature would not: take away pre-existing condition protections from Americans. And I just want to reiterate finally what Senator Wyden said. We now know a little bit more about the arguments that the Trump administration is making. What they said is that, well, the attorney generals would like for the Affordable Care Act to be invalidated today. The Trump administration went to court and said, well, why don't you wait until after the election to do that? Their argument was, of course, that it would be chaotic for people to lose their health care and their protections for their pre-existing condition before the election. Well, that's convenient. That's a nice, convenient argument to make. The reality is, if the Trump administration thinks that removing protections for people with pre-existing conditions would be chaotic today, why wouldn't it be chaotic in January or next September? It was a stunning admission today from the Trump administration. They know the damage, the devastation that would occur to American families if this lawsuit prevails, if Brett Kavanaugh is confirmed to the Supreme Court. But they're doing it anyway, because this isn't about American families. This is about a political grudge against President Obama. And we are going to continue to do everything that we can to make sure that the American public understands all of the different ways that this administration is trying to strip away these really important protections from Americans. Today was a very important day in which a lot of light got shed on this comprehensive strategy to weaken insurance protections for millions of Americans. Senator Smith.
Thank you. Good afternoon. And thank you to Senator Murphy and Senator Wyden. The Trump administration and its Republican allies have taken unprecedented steps to erode protections for people with diabetes, cancer, heart disease, and other pre-existing conditions. And today marks a new low. Today, as you've heard, oral arguments are being made in Texas versus United States, a lawsuit that is designed to end protections for people who have pre-existing health conditions. And the Trump administration has decided to weigh in on the side of allowing insurance companies to discriminate against people who have pre-existing conditions like cancer or diabetes. And at the very same time today, Judge Kavanaugh is testifying before the Senate Judiciary Committee during his confirmation proceedings. And if confirmed to the Supreme Court, he could be the deciding vote in the Texas lawsuit as it comes to the Supreme Court to tear down protections that people rely on. I am deeply concerned about this lawsuit and very, very concerned about the constant pressure of this administration to do away with protections for people with pre-existing conditions. I think about what this means for people in Minnesota. 2.3 million people in Minnesota have these pre-existing conditions. About 1 in 2 Minnesotans. That is about 300,000 children. Here is just one example of what that means in the lives of one person and one family. A couple months ago, I had the opportunity to meet Rachel. She is 32 years old. She is a young mom. She is an Olympic-level athlete. She played hockey for the Gophers women hockey team. She was also a former military member. And remarkably, horribly, Rachel was diagnosed with stage 4 lung cancer at such a young age, though she never had smoked. The medicine that she takes to keep her alive costs $15,000 a year, and she has health insurance. If she didn't have health insurance and her pre-existing condition was not covered by insurance, the cost just of that medicine would be 16 times more. She estimates it could be as much as $20,000 a month if she didn't have that protection from pre-existing conditions. Now, I think that taking away protections for people with pre-existing conditions is just flat out wrong. And the American public thinks exactly the same thing. And they also think it's a terrible idea. As Senator Murphy was saying, a year ago, there was one last attempt to repeal the Affordable Care Act and these pre-existing conditions, and it failed. And it failed because there was a public outcry against taking this step. And now in Texas, the Trump administration Republicans want to accomplish in the courts what they were unable to accomplish in the halls of Congress. And do not be mistaken. If confirmed, we have every reason to believe that Judge Kavanaugh would come down against protections for pre-existing conditions. And we know this for two reasons. One, because we can see the record of his decisions, and two, because the president himself has said that he is intending to appoint somebody to the Supreme Court who would undermine the Affordable Care Act. And in this case, I take him at his word.
Okay, let's go to open questions. Yes.
So obviously we're not in Texas, but some of the first reports from the hearing today say that Judge O'Connor was skeptical of sort of the Democratic State Attorney's general argument that the rest of the law should stand. I guess, what is your thought on that? Are you guys concerned that, based on what you've seen, that a preliminary injunction is coming?
No, I think this is just getting going. And the fact is, as we've said, today, Trump's own Department of Justice echoed what we're talking about. What we have said from the very beginning is that there's going to be bedlam in the private insurance marketplace. Now, by the way, the Republicans used to be for that marketplace. In my Healthy Americans Act, 8 Democrats, 8 Republicans stood behind airtight, loophole-free protection against pre-existing conditions. So I still believe that what we're going to see, and certainly there will be waves that will come where one judge will ask a question about this matter and another judge will ask a matter about another issue. But we know what this is all about. The Trump administration wants the ultimate domestic ideological trophy. And that ideological trophy is turning back the clock to the days when healthcare was for the healthy and wealthy. That's what you get if you allow discrimination against people with pre-existing conditions. If you're healthy, no problem. If you're wealthy, you pay for it. So this is going to take lots of stops along the way to the Supreme Court. But no one can doubt the determination of this administration to use every single tool, whether it's legislative, whether it is legal. I mean, I'm sure that the Trump people are worried about something that's going to happen before the election. My colleagues have made that point. What's not in question is their determination to get this ultimate ideological trophy. There is none bigger in terms of what's important to working families, somebody who's 57, 58, not yet eligible for Medicare. They are determined to get it. And you could see today with the arguments that we heard them making that they're going to make this case at every single stop. My colleagues want to add anything they can.
Yeah, I'll just add something quickly. And I obviously have deep disagreements about what the Republicans did in the tax bill by removing the individual mandate. But it would be a stunning act of legislating from the bench if this judge overrode the decision that Republicans made in the tax bill to keep the rest of the Affordable Care Act while removing the individual mandate, because that's what these attorney generals are asking, right? The Congress made a very clear decision to remove the individual mandate, but keep all the other parts of the Affordable Care Act. Now, I think that's a counterproductive decision, but that is clearly the will of Congress, given the fact that Congress could have repealed other parts of the Affordable Care Act. So this would, if the judge ruled in favor of the plaintiffs, it would be perhaps the most stunning act of judicial activism in my time in Congress. Now, clearly he's got a lot of people making that argument, and so of course we wouldn't be here if we weren't worried about the outcome of this case. But it would be, it would be a pretty big middle finger to the legislative branch.
Yes.
Senator Wyden, I was hoping you could talk a little bit more Senate right now. There, as of the start of this press conference, there hadn't been a huge amount of questioning from your colleagues about his view on pre-existing conditions and healthcare in general. How worried?
Well, I guess respectfully, I take some exception to that. I mean, the fact is we have been going to rallies across the country for months now. We have the Baldwin legislation on junk insurance. We have the Manchin legislation on pre-existing conditions. Day in, day out, we are pounding away at the fact that this is the premier domestic issue of our time. I have, for example, quoted, 50 times the Heritage Foundation remarks where Justice Kavanaugh strongly criticized Chief Justice Roberts for upholding key parts of the Affordable Care Act under the so-called constitutional avoidance doctrine. So again, apropos of Senator Murphy, Kavanaugh looks like he's in favor of what amounts to legislating from the bench. Years ago, he didn't buy into a conservative legal argument that the ACA's now repealed purchase requirement isn't a tax, but that doesn't mean he's interested in upholding the law. So all of the evidence, I want to turn this over to Senator Smith, to me, indicates that Democrats for months, whether it's in hearings, whether it's in rallies, I think maybe you attended our effort with the little lobbyists, these youngsters for whom, if you turn back the clock on pre-existing, conditions, it could affect them for years and years to come. So respectfully, I will tell you, I think Democrats have said for months, political change doesn't start in the nation's capital and trickle down. It's just the opposite. It's bottoms up. And on health care, we at the grassroots are just pounding away on health care. Senator Smith, you want to add anything? Because I know you've been having events on this too.
I think that your question is really about how much of an issue this is going to be during the confirmation hearings. Is that right? No, that's okay. I think that. Yeah. I think Senator Wyden made a great case for what a big issue this has been nationally, not only amongst those of us in the Senate, but what we hear from our constituents. The number one thing that I hear from my constituents is the importance of controlling the high cost of prescription drugs and for protecting pre-existing conditions. And I know that amongst my colleagues on the committee that this is going to be a significant issue that we will be discussing and raising. There are a whole series of issues that cause us all many of us to be greatly concerned about Justice Kavanaugh, but his apparent willingness to roll back protections for pre-existing conditions and really undermine health insurance for American families is preeminent.
Okay, yeah.
If Democrats, after the election, take back control of the Senate, are there policies, are there protections that you're eyeing to put up a firewall in case of this absurd judicial activism that you're calling it?
Well, I mean, the first thing we've got to do is we've got to find some ways to respond to the number one concern Americans have in the number one area, which is health care, and that is containing health care costs. And I think you will see Democrats in both the Senate and the House really zero in on the skyrocketing costs of pharmaceuticals. I mean, the fact is we pay more than virtually anybody on the planet, and we basically cover much of their research. And we've got a variety of approaches we feel strongly about. One, we think the major thing you ought to do is use your bargaining power. Now, everybody else in the private sector uses their bargaining power. We're not doing that with Medicare and in a number of other areas. Second, we think that the pharmaceutical, companies, if they want to have these major rate hikes, we are going to force them to prove that they're asking for this additional revenue in order to help people live better lives rather than to just produce more Me Too drugs and things that don't benefit the consumer. But what I can tell you is Democrats will be coming back on the number one concern in the number one area, which is health care, and that is containing health care costs in this country and zeroing in on pharmaceuticals. You want to take one more, guys? Give one from my colleagues. Yeah.
It's a very popular part of the Affordable Care Act, the pre-existing condition. And so, this is an advantage for Democrats to run on this issue. I know that you said, Republicans are putting out some political fig leaves so they don't get burned on this. But if you could please address the political, going into the midterms, this issue, how Democrats can use it, how they are using it, whether these fig leaves will work.
Well, I mean, listen, healthcare is the number one issue in all the public opinion polls, but we don't need to read the polls to know that it's the number one issue. And as you know, I spend part of every summer walking across the state of Connecticut, and for the last 3 years, healthcare is the number one issue that people bring up because they're scared to death that they're going to lose these protections. People wait for an hour along the side of the road to talk to me about their story and their illness or their child's diagnosis and how scared they are that their entire life is going to be ruined. I guess what's remarkable to me is that, Senator Wyden, and you referenced this bill that the Republicans have put in. I mean, what's remarkable to me is that they didn't even try to write a bill that actually protects people with pre-existing conditions. Now, they never had any intent to call this bill up for a vote or actually try to get it to President Trump's desk. So they could have put in a bill that actually solved the problem and then just never called it up for a vote. They are so in bed with the insurance companies that they couldn't even write a bill that actually protected people with pre-existing conditions. They wrote a bill that said insurance companies can't deny you a policy because of your illness, but then allowed the insurance company to deny you coverage for the kind of healthcare you need for that specific condition. So if you have cancer, you can't be denied an insurance policy, but the insurance company can exclude cancer treatment from the policy that they send you. So it's amazing to me that Republicans can't even write a bill that they don't even intend to actually debate that would solve this problem. And listen, we're talking about it because it's what our constituents are telling us we need to talk about. Whether or not there's a political advantage to talking about the issue of pre-existing conditions, this is what people in our states want us to be fighting for. And so, regardless of the political dimensions of this issue, we're going to fight for it.
Let's give the last word to Senator Smith, and I can tell you she goes home on weekends and then comes up to me and says, look, what people are talking to me about day in and day out is health care and what this turning back the clock is going to mean. So I think it's very appropriate you wrap it up.
I see that my job here in Washington, D.C. is to be the voice of Minnesotans. And what they tell me every day is that they just want the opportunity and the freedom to build the lives that they want. And they cannot do that if they cannot afford the health care that keeps them healthy or keeps them alive. And that's why I'm talking about this in Washington, D.C., and why I was talking about it in Cloquet, Minnesota, and Virginia, Minnesota over the weekend. And politicians, whoever they are, who ignore this voice, I think do so at their peril.
Thanks, folks.
Thank you, everybody.
Okay.
Good.
Thank you, too.
Thank you. Thanks, Tina. Thanks, Ron.